What are some of the biggest misconceptions or outdated beliefs about chiropractic that you find yourself frequently debunking?
The biggest one is safety. And chiropractic continues to prove over and over how it is, if not the one of the most or one of the safest forms of healthcare you can enter into. And the last statistic was if you're concerned about getting adjusted, then you should be concerned about driving to our office. Obviously, there's risk in everything that you do in life, but there's some things that are just such minimal risk that you don't even think about it. You just get in the car and go. Obviously, that you take certain precautions to even lower that risk, whether it's making sure you put on a seatbelt and you make sure that you're, using blinkers and you're giving safe distance between you and the car in front of you. It's the same thing that the chiropractor does. That's why we ask all these questions. That's why we do these exams. It's to ensure that you are healthy enough to undergo this type of procedure. And once those boxes are checked, we go through that checklist, then the safety is it's not even comparable to the other forms of healthcare, that whether it's a medication, an injection, or a surgery. Some of the other myths that I have to debunk are, once you go to a chiropractor, do you have to go forever? And it's an interesting question, because I always think that, well, you can kind of do what you want. I mean, anybody can do anything they want. Nobody is forcing you to make decisions in your life. But to answer the question from a true clinical perspective is that, no, we can adjust your spine. I have many different patients that have come in with an acute disc issue. It takes us a few weeks, a series of treatments to get them back to where they are supposed to. They are stable. They got to the point where the pain was gone, and then ultimately their condition was stable. We discharged them, and I never saw them again. And that's fine. That's the way they chose to utilize us. We prefer people to be more preventative in nature, and so they address those issues and prevent those conditions from surfacing in the first place. And so what we see happening over and over and over again is patients get introduced to chiropractic care. They see how much less stressed they are. They see how much better their body's moving. They see how much better they're sleeping. They see how they're able to do bends and lifts and twists without the catch in their back. They can do yard work. And so ultimately they choose to use us for the long haul. And it's the same thing with a dentist. I mean, you don't question anymore why you go twice a year in order to get your teeth cleaned, right? And so that's the same thing we're trying to educate patients on, is your spine is, if not the one of the most important parts of your body. It houses the central nervous system with the spinal cord. And so if it's not functioning correctly, good luck. And so we want people to be proactive, to continue to get those regular spinal adjustments. And every single person's different. The research suggests that if you undergo regular adjustments on a 4-week increment, then you can reduce your days of disability by 28 days a year. But not everybody fits into 4 weeks. Some people with degenerated arthritic spines may take every 2 weeks. Some people that are extremely healthy may only need quarterly adjustments. And so we can construct that plan that is best based on you and your needs and what ultimately the research suggests, but also how well you feel.